So this is the Chapter 9 in-class worksheet activity, and we'll be going over the answers. So question number 1 says identify the two types of joints shown in the X-ray below. For each joint, classify the joint by using the vocabulary learned in this chapter and discuss the types of movements allowed by that joint. Discuss the trade-off between strength and mobility at a joint. Finally, identify the joint problem shown in the X-ray image. All right, so let's take a look at the joints first. So here outlined with the yellowish orange color is the acromioclavicular joint. So this is a joint between the acromial end of the clavicle and the acromion of the scapula. This is a type of diarthrosis or synovial joint, and specifically it is a gliding or plane joint. This means it allows slight sliding movements, but nothing really fancy. The next joint that we can see is what's called the shoulder joint or the glenohumeral joint, and this is between the head of the humerus and the glenoid cavity of the scapula, and these are outlined in brown. This is also a diarthrosis or synovial joint, and this is a type called a ball and socket joint. So this type of joint gives you a wide range of motion. You can do circumduction, rotation, abduction and adduction, and flexion and extension at this joint. And then talking about the trade-off between strength and mobility, remember that as strength increases, mobility decreases and vice versa. So for the shoulder joint, this is one of the joints with the widest ranges of motion, but that also makes it the weakest joint in the body. And then this X-ray is showing what is called a shoulder separation, which is a dislocation of the acromioclavicular joint. So you can see in the X-ray that the clavicle and the acromion are not touching each other like they should. So this is what we call a shoulder separation. What we call a shoulder dislocation is when the head of the humerus comes away from the glenoid cavity of the scapula. Question 2. Identify the major joint shown below. What are 3 reasons why this is a stable joint? Then identify the 3 individual joints that make up this larger joint. Classify these joints and discuss the types of movement allowed by each joint. All right, so this is the elbow joint. And the 3 reasons this is a stable joint is first, the bony surfaces of the humerus and the ulna interlock. So the trochlear notch of the ulna fits right around the trochlea of the humerus and allows those bones to interlock with each other. There is also a single thick joint capsule that surrounds all of the joints in this area. So each joint doesn't have a separate joint capsule. There's one joint capsule for all 3. And then there are very strong ligaments that reinforce the joint capsule. So the first joint that we can see here is the humero-ulnar joint, and that is shown in the orange-yellow color. This is between the trochlea of the humerus, which is the part of the condyle that looks like a spool, and the trochlear notch of the ulna, which is that C-shaped part, and you can't see the C-shape because it's wrapped around the trochlea in this picture. This is a diarthrosis or a synovial joint, and specifically it is a hinge joint. And this type of joint only allows movement in one plane or one axis, so it only allows flexion and extension. The next joint we can see is the humeroradial joint, and that's outlined here in brown. This is between the capitulum of the humerus and the head of the radius. This is also a diarthrosis or synovial joint. Technically, if you were to take everything else away and you just had the radius and the humerus here, this would be a ball and socket joint where the capitulum looks a bit like a ball and the head of the radius has a socket. But because of the way the ligaments wrap around the elbow, it restricts this to acting like a hinge joint. So it can only work in one direction. So it permits only flexion and extension. And then we can see another joint here highlighted in this bright blue color. This is the proximal radio-ulnar joint, and this is between the radial notch on the ulna and the head of the radius. This is also a diarthrosis or a synovial joint. And the specific type of diarthrosis, it is a pivot joint, and that means it only allows rotation. So the head of the radius can rotate up against the ulna, and this is what allows you to supinate and pronate your forearm. Question 3 says identify the major joint shown below. Identify the accessory structures of this joint that were discussed in the lecture. Then identify the 3 individual joints that make up this larger joint. Classify each joint and discuss the types of movement allowed by each joint. Okay, so this is the knee joint. And if we go over the accessory structures, and again, these accessory structures can apply to all types of joints, not just the knee joint, but we're discussing it here because the knee joint is one of the joints that has all of the accessory structures. Some joints have 1 or 2 accessory structures, but not all of them. So the first one is a meniscus. This is a pad of fibrocartilage. This allows the joint surfaces to fit or conform better together. And the knee joint, which we're looking at here, has both a lateral meniscus and a medial meniscus, and so this is the little pad of cartilage that you see between the ends of the femur and the tibia. Notice that I know that this is the lateral meniscus because it's on the same side as the fibula, and if you remember, the fibula is lateral and the tibia is medial. Another accessory structure is the fat pads. These are adipose, little pockets of adipose tissue that act as space fillers and help to fill in the spaces in the joint and make everything more cohesive. You can also find bursae. These are synovial fluid-filled pockets that form under tendons and ligaments to reduce friction and absorb shocks. A singular one is called a bursa, and if these become inflamed and cause pain, that is called bursitis. And then we have tendons and ligaments. These serve to reinforce the joint capsule, they provide mechanical support, and they can limit the range of motion so that a joint is not overstressed. The knee, which we're looking at here, has 7 supporting ligaments, including the anterior cruciate ligament, or ACL, and the posterior cruciate ligament, or PCL. And in this image here, this is an anterior view of the knee. We can see the anterior cruciate ligament right here. You can see a little bit of the PCL behind it, but I didn't label it. So now let's look at the actual joints in the knee joint. So we have the joint between the femur and the tibia, and those are in orange yellow. So you have it between the medial condyle of the femur and the medial condyle of the tibia, and between the lateral condyle of the femur and the lateral condyle of the tibia. This is a diarthrosis or a synovial joint, and the specific type is a hinge joint. That means that it permits only flexion and extension. We can also see the femur patella joint, which is outlined in brown. This is between the patellar surface of the femur and the patella, which is a sesamoid bone. This is, again, is a synovial joint or a diarthrosis, and the specific type is that it is a gliding or plane joint. And this permits the patella to move slightly in a superior and inferior direction, but not a whole lot of movement. Another joint that we can see here, it's not really part of the knee per se, but we can see it in this image, so we're going to talk about it, and that is the proximal tibiofibular joint, and you can see that one outlined in bright blue. So this is between the tibia and then the head of the fibula. This is also a synovial joint, and it is a specific type. It's a gliding or plane joint, which allows very little movement. Question 4, identify the major joint shown below. Which is more likely to occur at this joint, a dislocation or a fracture? Why? Classify this joint and discuss the types of movement allowed by this joint. So this is a hip joint. And by the way, this image is showing some of the accessory structures. We can see the ligaments wrapping around. We can also see a fat pad over here. It's this yellow, bubbly looking stuff. That's just an aside. All right, so the question was, what is more likely to happen, a dislocation or a break? And the femur is more likely to fracture, and the femur will fracture either at the neck or between the greater and lesser trochanters before this joint would become dislocated. So you're more likely to get a break in the femur than you are to have the head of the femur come away from the hip bone. And the reason is that this is an extremely stable joint, and that is because you have a really tight fit between the head of the femur and the acetabulum of the hip bone. You also have a very dense, strong joint capsule that surrounds this joint. It is also reinforced by 4 very broad ligaments that wrap around the joint. And then there are a lot of muscles that surround this joint and also help stabilize it. So all of these together mean that this is a very stable joint, and you're more likely to break the bone than dislocate the joint. And there is one joint to see here, and that is in the orange-yellow color, and this is called the hip joint. And this is the femur of the head that fits into the acetabulum of the hip bone. This is a synovial joint or diarthrosis. Specifically, it is a ball and socket joint. This type of joint gives you a wide range of motion, including circumduction, rotation, abduction and adduction, and flexion and extension. Question 5 says, look at the x-ray below. What joints can you identify? Classify each joint and discuss its range of motion. So believe it or not, there are 7 different types of joints in this picture. There's more than 7 joints. So everywhere you see a bone connect another bone is a joint. But there are actually 7 different types of joints in this picture. So let's identify all of them. All right, so we're going to start with the carpometacarpal joint of the thumb. And I've highlighted this in the orange-yellow. So this is between metacarpal 1 and one of the carpal bones, and specifically it's the trapezium. So you can see it, again, it's outlined in the picture. This is a synovial joint or a diarthrosis. Specifically, this is a saddle joint, and it is the only saddle joint in the body. And this type of joint allows a wide range of motion. You can get circumduction, you can get abduction, adduction, and flexion and extension. And then what is unique to a saddle joint is you can also get opposition and reposition. Another type of joint we can identify are the carpometacarpal joints for the other fingers. So this one here was the special one. This is a saddle joint. The other 4 are all different. So these are between metacarpals 2, 3, 4, and 5 and the carpal bones. These are all synovial joints or diarthroses. Specifically, these are all plane or gliding joints. So these are like right in the middle of your palm of your hand, so you don't have a whole lot of movement in the palm of your hand. And so only very slight movement is allowed between these bones. The next set are the metacarpal phalangeal joints. So these are between the metacarpals, so metacarpal 1, 2, 3, 4, and 5, and the proximal phalanx of each digit, right? So the proximal phalanges. All of these are diarthroses or synovial joints, and they are specifically the type called a condylar joint, which can also be called an ellipsoid joint. So these allow a wide range of motion, so you get circumduction, abduction and adduction, and flexion and extension. So this is the base of each of your fingers. The next joint we can see is an intercarpal joint. So these are the joints between the carpals, and I just tried to highlight some of them. I probably didn't get all of them. So these are diarthroses. Specifically, they are plane or gliding joints, and so this means that they allow a very slight movement. The next one is an interphalangeal joint. So this is between each of your phalanges, so phalanx to phalanx. So in the thumb, we only have one, so it's between the distal phalanx and the proximal phalanx. And your other 4 fingers, you have 2. So you've got one between the distal phalanx and the middle phalanx, and one between the middle phalanx and the proximal phalanx. So a total of 9 different interphalangeal joints. These are all synovial joints or diarthroses. Specifically, these are all hinge joints. Remember, a hinge only allows movement in one direction, so these permit only flexion and extension. So these are all the little small knuckles of your fingers. We can also see a radiocarpal joint. So this is between the radius and the carpal bones, and is highlighted in brown. This is also a synovial joint or a diarthrosis, and specifically this is another condylar joint, also known as an ellipsoid joint, like we saw between the metacarpals and the proximal phalanges. So this allows a wide range of motion. This allows circumduction, abduction, and adduction, and flexion and extension. So this is what makes your wrist very mobile. So this is mainly your biggest moving wrist joint. We have one other joint that we can see at the wrist, and that is the distal radio-ulnar joint, and that is in blue. This is between the ulna and the radius. This is also a diarthrosis or a synovial joint. Specifically, this is a pivot joint, and it permits only rotation, and it allows the radius to rotate around the ulna, and this allows you to supinate and pronate your forearm. Question 6 says, look at the arthritic knee shown below. Differentiate between osteoarthritis, rheumatoid arthritis, and gouty arthritis. So remember that all arthritis or arthritis itself is a term that we use to describe damage to the articular cartilages. And this is the hyaline cartilage that covers the ends of bones at synovial joints. So in this image, the cartilage is shown as this sort of light pinky purpley color. So anytime this cartilage degrades or breaks down, that is called arthritis. And then there are several ways that this can happen, and the three that we want you to know are osteoarthritis. This is when the damage happens due to the cumulative wear and tear that occurs over time and with age. Then you have rheumatoid arthritis, which the damage to the cartilage is due to the body's own immune system attacking the cartilage. And then with gouty arthritis, the damage is due to the buildup of uric acid crystals in the synovial fluid, which can cause pain and damage the cartilage. So bottom line, arthritis is damage to articular cartilage, and we classify it based on how you got that damage. Number 7, look at the image below. What types of joints are shown and what is their classification? What is the range of motion allowed by each type of joint? And then what joint injuries are shown? So this is the vertebral column. So the first joint we're going to look at are the intervertebral joints between the articular processes. And these are highlighted in the orange-yellow color. So these are going to be between the superior articular process on one vertebrae and the inferior articular process on the other vertebrae. And so this repeats all the way up and down the spine. These are all synovial joints or diarthroses, and specifically they are plane or gliding joints. Now normally these types of joints don't allow much movement, but the cumulative action of all of these gliding joints up and down the vertebral column some to give the vertebral column more motion than you would usually expect. So the cumulative action allows your vertebral column to flex, extend, do lateral flexion, which is bending side to side, and rotation. The other type of joint that we can see here are the intervertebral joints between the vertebral bodies. So this is where we have a fibrocartilage pad between the vertebral bodies of the vertebrae. This is a type of joint called an amphiarthrosis, and specifically it's called a symphysis. And so this type of joint only allows very slight movements. So if we look at some issues that we can see in this image, circled here is an example of a bulging disc, sometimes also called a slip disc. So the distortion of the inner nucleus pulposus causes the outer annulus fibrosus to bulge or protrude into the vertebral canal. And so that is shown by the dark blue little bubble here. So it hasn't actually broken open, but the outer covering called the annulus fibrosus is protruding. The next problem is the herniated disc. This is when you actually have the inner nucleus pulposus breaks through the outer annulus fibrosus to protrude. So you can see the lighter teal color that represents the inner part of that fibrocartilage pad has broken through the outer annulus fibrosus. Also shown in this image, but we didn't talk a whole lot about in lecture, are the disc degeneration. This happens as you age. This is from cumulative damage to the fibrocartilage over your lifespan. As you age, you also lose water content in the nucleus pulposus, which is the inner portion, and so that causes it to lose height as well. and this causes you to overall lose height as you age. This is why you get shorter as you age. And then another problem shown here that we haven't mentioned before is osteophytes. So osteophytes, these are those little bits of bone sticking out around the edges of the vertebral body. These are also commonly referred to as bone spurs, and they can form on joints that are damaged by arthritis. And what happens is that one bone starts rubbing up against the other bone because of the damage to the cartilage in between. And by those bones rubbing together, it signals bone growth. So it's actually the bone trying to repair itself. But the bone growth ends up causing these little spurs that stick out. And these can also cause problems if they press backwards and press on spinal nerves. So these are bone spurs that can develop on joints damaged by arthritis. These can actually happen in any joint in the body that has arthritis. And they result from bone growth triggered by bone-on-bone contact that happens as the arthritis is breaking down the articular cartilage. Question 8. Identify and classify the joints in the image shown below. What range of motion is allowed by these joints? Okay, so first we're going to talk about the sutures. So the sutures are between each cranial bone and the facial bones. I highlighted some of them, but you also have sutures over here between the facial bones that I didn't bother highlighting. For example, here's a suture right down the middle of the zygomatic arch. So anytime you have a cranial bone touching another cranial bone, or a facial bone touching another facial bone, you're going to have a suture. These are a type of joint called a synarthrosis, and a specific type of synarthrosis is a suture. So they're actually called by the type of joint they are. And these allow no movement whatsoever. So synarthroses are joints that allow no movement. We can also see the temporomandibular joint, abbreviated TMJ, and that is outlined here in brown. This is between the condylar process of the mandible and the temporal bone. This is a synovial joint, or a diarthrosis, and this is a combination hinge joint and plain gliding joint. So this allows your lower jaw to elevate and depress, also to protract and retract, and then some slight lateral gliding, so you can move your jaw a little bit left to right. And then you can review these different movements by going back to the lecture video. And we can also see what's called an alveolar joint, which is highlighted in light blue. This is the joint between the mandible and each tooth and the maxilla in each tooth. And these are a type of joint, again, called a synarthrosis, but this is a specific type of synarthrosis called a gomphosis. And as with all synarthroses, these do not allow any movement. So your teeth should not move around in their sockets. Number 9, label the features of a typical synovial joint, then list 3 functions of synovial fluid. All right, so to label the picture first, we have the periosteum up here. This is that membrane that surrounds the bone. We're also showing some ligaments, which are bone-to-bone connections, and ligaments can often wrap around and stabilize joints, so they're accessory structures. We can also see the joint cavity in here, and this is full of synovial fluid that is made by the cells that are in the synovial membrane. We can also see the articular cartilage, which is the hyaline cartilage that is on the ends of the bone that are connecting at a synovial joint. We can see the joint capsule. So you can see if you follow the periosteum down, it ends right here where you see these dark purple lines, and then that's when the joint capsule starts. The joint capsule wraps around, then it ends down here with these other dark purple lines, and then it becomes a periosteum again. And then the green line in the middle, that is the synovial membrane. That is an incomplete epithelium, but the cells produce the synovial fluid that fill the joint cavity. So 3 functions for the synovial fluid. It helps to lubricate the joint to reduce friction. It also provides nutrient distribution for the chondrocytes in the articular cartilage. So remember, as you move the joint, these articular cartilage pieces act like sponges, and they soak up the fluid and then squeeze it back out, then soak it back up, then squeeze it back out, and that allows for nutrients to get in and out of the cartilage and to the chondrocytes. And the synovial fluid also provides shock absorption to protect against shocks and sudden impacts. So the viscosity of the synovial fluid actually increases as the pressure inside the joint capsule increases. And the last question, number 10, identify and classify the joints in the image below, not the vertebral column because we've already covered those. What range of motion is allowed by these joints? So the first one is the sternoclavicular joint, and that is highlighted as you have to look closely. It's the little bit of yellow-orange up here at the top of the sternum. So that is between the manubrium of the sternum and the sternal end of the clavicle. This is a diarthrosis or synovial joint, and specifically this is a plane or gliding joint. So it allows slight sliding movements, but this is also the joint that allows you to protract and retract your scapula and elevate and depress your scapula. So you can move your scapula up and down like when you shrug your shoulders, and then you can also curl your shoulders forward, and that would be protraction and retraction. We can also see the first sternocostal joint, and that is highlighted in brown up here. So it's again off of the manubrium of the sternum. So this is between the manubrium of the sternum and the first costal cartilage. This is a synarthrosis, which is a type of joint with no movement. Specifically, this is a synchondrosis because it's between a bone and a piece of cartilage. And as I just mentioned, because it's a synarthrosis, it doesn't allow any movement. Your second through seventh sternocostal joints, these would be between the body of the sternum and then those second to seventh costal cartilages. So this whole area highlighted in the bright blue. So 2, 3, 4, 5, 6, 7. There's your second through seventh costal cartilages. These are diarthroses, specifically plane or gliding joints. So they allow very slight movement, and this allows your rib cage to expand as you breathe. And then the last joint that we can see are highlighted in green. There are several of them on both sides. These are between each rib and the costal cartilages, well, except for the faults or the floating ribs. And these are synarthroses, and specifically these are also synchondroses, so between a bone and a cartilage, and no movement is allowed. And that is it for the Chapter 9 activity.